So my name is Shahnaz Sultan. I'm at the University of Minnesota in the Minneapolis VA, and I'm the chair of the Clinical Guidelines Committee.
Hi everyone, I'm Andrew Wang from the University of Virginia, and I am the chair of the AGA Clinical Practice Updates Committee. So Shazi, I've learned so much from being a part of your committee and from watching your committee work. I'm very impressed by it. Please tell us what makes up a clinical guideline. What makes up a guideline?
That's a good question. So we develop clinical practice guidelines really to help improve the care of patients with GI conditions. We follow standards for trustworthy guideline development as outlined by the Institute of Medicine, now the National Academy of Medicine, WHO and GIN, Guidelines International Network. And we follow the GRADE framework for guideline development that really lays out specific criteria that help you determine the confidence you have in the evidence that supports recommendations. We call that the certainty of evidence or the quality of evidence, as well as the strength of recommendations. And we develop strong or conditional recommendations as laid out by the GRADE framework.
I've been so impressed by just watching your committee work. I know it's a huge lift. Each of these guidelines has interesting and important clinical questions. I believe they're called PICOs, and I think each PICO goes through a heavy lift, a systematic review, and often meta-analysis.
That's right. One of the main things that underlies the GRADE framework is to really look at the best available evidence for each individual PICO question. And PICO really just lays out a framework to ask a question outlining the population, the intervention, the comparator, and the outcomes. And we'd look at data that informs each outcome across studies and look at that pooled effect estimate and make judgments about how confident we are in the estimates of effect that we're seeing. And then we use the evidence to decision framework, another framework that lays out elements that drive decision making, including the certainty of evidence, the net benefits and harms, patient values preferences, resource considerations, and then equity, feasibility, and acceptability. So it's a pretty rigorous process.
Yeah, it's amazing. So each recommendation that we see in these guidelines often has gone through multiple members vetting, sometimes thousands of abstracts or papers, and often conducting new meta-analyses.
Yeah, so we use kind of a hybrid approach. If there are existing systematic reviews that are well done, we'll often incorporate them into our guideline process. But for many of the PICO questions, we end up doing a full systematic review because we're often missing information about other important outcomes that are relevant or data around harms or downsides of specific interventions. So tell me about your committee and how you develop clinical practice updates.
Yeah, so the guidelines are important documents, and the AGA developed the Clinical Practice Update Committee to fill this important clinical gap. There are important questions that may be developments in endoscopy or inflammatory bowel disease or liver disease that do not have enough published evidence to support a guideline. And so the CPUs, we call them, fill this kind of temporary need as data is being generated. We have two main manuscript types, the expert review and the commentaries. We usually have a diverse writing group of experts in the field who put together the best available evidence and also use expert opinion and input to inform clinical best practice advice. So we use words such as suggest or could or should, but we try to avoid words like recommend because we're not really advocating a clinical guideline level of evidence, but really trying to fill the gap to help clinicians and those in the field take care of patients.
You've been very productive with the CPU committee. Do you want to tell us about how you decide how many clinical practice updates you publish and what topics you cover?
Yeah, we publish anywhere from 15 to 20, 25 of these a year. And so we would love to get input from those of you who are watching this at DDW or at home. Please go to the AGA's clinical guidance website where you can find our clinical guidelines and CPUs, and there's also an area where you can click and offer advice for future clinical practice updates and guidelines. As part of our process, we solicit input from all sorts of parts of the AGA, including the governing board. We asked for input from the associate editors and editors-in-chief of gastroenterology and CGH and the other AGA journals. We also solicit input from the other chairs of committees in the AGA, and really we want to get as much input as possible. Once we have a list of topics on either a 6 or 12-month basis, depending on how many we have floating at one time, we then rank order them and work with the journal editors to really pick what may be most impactful and timely at that given period of time in a topic's kind of life course. And so it's a really involved process, and I really think we do a great job, and I'm very proud of our product.
Yes. We similarly also are very interested to get feedback from our members about topics that we should cover as topics for new clinical guideline development. We have a few upcoming guidelines that are hopefully going to be interesting and informative to our members, focusing on artificial intelligence, focusing on fecal microbiota transplant or intestinal microbiota transplant, and again, pushing the field in terms of our understanding of where GI doctors fit in the management of obesity.
Yeah, likewise, we hope to put out relevant documents such as a very highly cited one about the de-escalation of proton pump inhibitors. We've published on surveillance after endoscopic submucosal dissection of GI neoplasia, and we have a series of CPUs coming out about management of acute and chronic pancreatitis, various aspects of inflammatory bowel disease, as well as diet and IBS. So really, please look for the upcoming slate of CPUs. We're also developing podcasts. We have a few out already. Shazi's been on one with our former chair, Joe Lim. But we're developing podcasts that will also help others to kind of get some of this information via different media forms. So it's really been a great process. I think our documents are high profile. They're used by clinicians, by fellows, residents, even payers to help inform decision making. And really the process is quite high level for the CPUs. They actually go through not only committee review and governing board review, but formal peer review through the journals.
I look forward to reading those CPUs.
Likewise for the guidelines.
And it's been a pleasure here to speak with you today.
Pleasure's been all mine. If you guys would like, please find Dr. Sultan and myself on Twitter. We'd love to get your input and advice for upcoming topics for CPUs and guidelines.
Stay safe, everyone.
Thank you.